Health experts have warned that if the country delays distributing the COVID-19 vaccines to South Africans at large, the country risks facing a third wave. Last week, South Africa had its deadliest day since the outbreak of the coronavirus in the country, with 840 deaths. Now, to discuss this further, we joined via Zoom by Professor Alex van der Heever, the Chair of Social Security System Administration and Management Studies at the Wits School of Governance. Thank you very much for coming through, sir.
Hi, good evening, good afternoon.
Well, the country has for the last week recorded the highest number of COVID-19 cases and deaths. The push up of these numbers is shockingly high. Can you just take us through, perhaps for somebody who is really panicking and not knowing what's going on with this variant and what causes it?
So this is not necessarily just the variant itself. It's potentially driven by human behavior. And what we see at this point in time, let's say today, in terms of new infections, is really a consequence of behavior over the past sort of two weeks and prior to that. So it becomes community-based, and it tends to be very difficult to remove once you've got a very high level of infections in the community. So we're seeing very, very high levels in Gauteng and KwaZulu-Natal that have exceeded the previous peaks. Both Western Cape and Eastern Cape also exceeded their previous peaks, and although they are stabilizing. But both KwaZulu-Natal and Gauteng are continue on an exponential increase, which means that we are going to face a very difficult situation in these provinces over the next couple of weeks. So there's no apparent change yet. But the restrictions, when they were put in place, should have had an impact on behavior, but they won't necessarily come through in the data yet.
So when it comes to the deaths, I mean, like, they are coming closer to home because people hear about somebody having died on television or radio or perhaps reading newspapers. But right now it has come to the neighborhood, and right now COVID-19 is real and people are seeing the impact when they hear of somebody close to them having died. So looking at 19,000 deaths, and to now, or not deaths rather, but the infection rate at 19,000 going to 17,400. What do you make out of this slight drop in the infection rate?
I don't think we really have a drop. If we look at the 7-day moving average, which is a better number to look at, it smooths out the discrepancies in detecting in sort of uploading the results. So we sometimes have weekend variations or declines. So I think what we're seeing on a 7-day moving average is a continuous increase, and so there is no real drop at this point. We will probably only start seeing a decline in a couple of weeks. So I think we're still in a very, very serious position at this point. And a lot of it is because people were very, very complacent about the epidemic, thinking that it had largely gone away. And it's once it's escalated to a particular point, it takes a while for it to run its course. So it's I think we're in for a bit of a rocky ride in Gauteng and KwaZulu-Natal, as well as Limpopo and various of the other provinces outside of the Western Cape and Eastern Cape, which look like they're stable at this point.
So now, what's going to happen? Are the numbers going to remain high as we see them now, and will vaccination be the only way to go in as far as this 67% target by government to give people vaccines by the coming 12 months?
Yeah, so vaccines are really our only route out of this situation. It's an incredibly difficult situation because it appears as though human behavior, people become very complacent when we pass a peak. So I think that, South Africa's never really been through this before. So after the initial surge, people became complacent. Their behavior converges back on normal behavior, which is natural. but it causes the second surge. The question is whether or not people after the second surge will go back to normal behavior. But if we do not get the vaccine in place timeously this year, we will face a third, possibly fourth surge during the course of this year. And our winter surge will probably be very difficult for us to, very difficult to contain. Because during winter, it's quite difficult to stop super spreading events. People are indoors a lot more. But I think it's absolutely crucial that we get going on the vaccine strategy. The only question is, how much can we deliver in 2021? And it appears as though
Yeah, okay, you got cut off a little bit there. I thought I actually had lost you, but it's okay now. You know, the last time I heard about the way to flatten the curve was last year. Do you think we'll ever get there? More especially now that many people are wondering what President Cyril Ramaphosa will say tonight. Should the people expect stricter lockdown measures, and also business people start to shiver in their boots?
I think we're probably going to see an extension of the current restrictions, with maybe a sort of a slight deepening of one or two of them, such as the curfew. South Africa is not really in a position to introduce level 4 or level 5 lockdowns, because the impact on the economy is too devastating, and government is not in a position to support the people who are harmed when they lose their jobs. So the socioeconomic effects are quite extreme in the South African context, where they will be less extreme, for instance, in the United Kingdom or France or the United States. But here they are severe. So I do expect that they will deepen, and they will seek to enforce the rules as they stand. They have to keep focusing on the gatherings. But I don't think that the restrictions as introduced have had enough time yet for us to see the full effects. Because when they were introduced, a lot of what we're seeing now was baked in. So we will probably need a few weeks extension of the current restrictions to have an impact in provinces such as KwaZulu-Natal and Gauteng.
All right. Thank you so much for making time to speaking to us. That's Professor Alex van der Heever, who is the chairperson of the Social Security Systems Administration and Management Studies at Wits University.